Now, the Institute of Medicine report on quality of cancer care, now this was released back in 1999, last century.
I was there.
So was I. Highlighted the gaps that existed in the care of cancer patients, my kids weren't, and emphasized the need to develop a core set of measures to assess quality. Additionally, organizations, and we've talked about ASCO before, are working toward establishing certain quality measures to improve the patient-centeredness of treatment regimens. So, what are the key measures in oncology, and how often are they reviewed or updated? I'm assuming something's happened since '99.
Yeah, we got about 20 opinions and no harmonization. So the answer is there are no key quality measures that everyone agrees upon.
Yeah, I think it's an open question. It was even debated last week, and the folks that came to the table are still
Yeah,
saying,
we were at that meeting, so-
the folks
There was
are-
15 years of debate,
So,
or more.
So, you know, I think a lot of people have expressed opinions. Most recently, CMMI has told us the quality metrics that they want to include as part of their reimbursement reform. There's a lot of them. They actually don't have much relationship to the other ones that are out there. It's really, really challenging. Some things are pretty easy to get your hands around, right? So ER utilization, hospitalization rate, end-of-life care, those are fairly harmonious across the platforms, but there's very little harmony otherwise. And there are tremendous challenges because if you're a pragmatist, you want people to measure and report both on things that are important, but also things they can report on.
You
In
can
other
only
words,
report
you
on what you
can't
can report.
build the perfect mousetrap and expect people to utilize it. It just is not going to work.
It's like Rumsfeld. We don't know what we don't know. We do know what we know. It's tricky, right? Because some of these interstices are really not well defined, I guess.
Yeah, that's true.
So how important then, we come back to patient-centered care for a second. When we're discussing quality in oncology, okay, and we're assessing all of this value added, how important is patient-centered care in all of this?
Oh, very important. And I like to joke that I, was a college dropout and I worked as a suit salesman.
Okay.
So, quality is what the patient experiences to some degree.
Were you, by the way?
I was, yeah.
Oh,
Yeah.
that
Mike can
explains
tell
it.
you, we go to meetings, I take people's suit sizes.
I was about to say, look at this beautiful suit. I was wondering about that.
Thank
But
you.
Go ahead.
But so I think that the patient-centered care has to be part of the quality discussions because as we get into more and more segmented, individual, personalized medicine, it's going to be more important because it's going to be the determinant about what's better, what's worse.
Okay.
We're going to have to make these decisions on toxicity, safety, tolerability, quality of life. And so if you don't have that patient-centered component, you're not going to be able to put it all together properly.
Isn't that sort of like saying the patient's got to be part of the discussion?
Yeah.
If not the patient, certainly the family. And it brings us right back to the end-of-life discussions at the 90-year-old level or whatever.
Yeah, if you don't have a patient-centered approach, I think everything we've discussed at this point in time, we can talk about pathways and institution of pathways. I think pathways look at one thing, they look at cost. And there's a few little peripheries and offshoots of it. But once you develop that patient-centered approach, the total approach to the patient, and can reconfigure your practice to do what's necessary, that's where you're going to get your best chance of developing quality is.
Okay.
Yeah,
Well, we have, go ahead.
I just want to say, to that point, one of the things that we've seen as we're trying to make this evolution on the private payer side to create some kind of program or set of programs that get the best outcomes, we think that moving a little bit more towards an oncology medical home approach
Okay.
is important because it does fulfill this patient-centeredness box. It checks that box, and that's the box we want to check.
Okay. And which aspects of